The very important thing about the sideline is the position itself. I saw over and over and over again, I saw people that were content to just do this or whatever. Get them back as far as you can. Now, of course, there are considerations for the size of the person and whether or not you're concerned about them falling off the table. You have to, you have to weigh all that. Have them hold on here. Have them bend the bottom leg to stabilize themselves, and then this leg comes off the edge here. There we go. That's textbook, okay? There we go. So don't compromise that. Your success here is dependent upon the position that you get them. You want these muscles at tension, and it's real important here. So the first thing we do is we find the landmark, okay? Greater trochanter, okay? There it is in her case right here, okay? And just off the greater trochanter, those tendons, we're gonna work them across initially with the fingers. Then we're going to expand it back and forth across the whole musculature of the gluteus minimus, medius, a lot of the max as well. Okay, so just check. Maybe the first session, that's all you'll be able to do. Maybe the first 2 sessions, you might only be able to get fingertips like this. Once you've worked that out a little bit, keep in mind that this area here is notorious for getting worse the more you work on it. So as you start to work over the first couple of minutes, it's going to get more and more and more sore. And it won't really ease up for that treatment. It won't get better as it goes on. This ligament down here will get better along with treatment. Okay, so once that might be all you do, is fingers that time. You can then eventually go to forearms, okay? Work it back and forth with forearms. Remember the crest of the ilium, the attachments on on this side of it, we're going to work the attachments this side. We're not going to go over the crest just yet. At the end, the last of it's going to be, now you might, with elbow, get right on that tendon here, gluteus medius minimus tendon. Work that tendon. You're not going to really work it, you're just going to hold on to it. Just going to hold it here. And then eventually, you back out working this with and then eventually, elbows all the way around the attachments of the glutes here. And I'm going faster than you normally would. You would normally just hold it and barely move, okay? But I'm showing you, for the sake of the demonstration, I'm showing you the route that we would take.